I want to spend a few moments talking about managing mental health disorders, behavioral health care disorders of an existing nature during this experience of the pandemic. Some of the fears and anxieties that may go along with living with a chronic mental health condition or behavioral health care condition are going to be reasonably, how am I going to continue to get the care that I need? It's an identifiable diagnosis, an identifiable illness. And the questions that come up about how am I going to maintain and manage my illness continuously during this pandemic? First and foremost is to recognize that access is always going to be available. We may be experiencing and utilizing new technology and new strategies, including telehealth, in order to have you to reach out to your provider, to evaluate and assess what's happening for you on an ongoing basis, and continue to maintain the current treatment plan that you already have in place. If you're being told that you're in quarantine and cannot get out to your provider, again, there are strategies and technologies that we can utilize in order for you to get the information to your provider that you need to. Again, that may be telehealth, using Zoom platforms and other computer-based platforms where you can actually be seen by your provider who can continue to evaluate and assess. It may mean that you can only respond to your provider telephonically, picking up a phone and calling you and assessing where you're at. Getting to you the necessary things that you need, for instance, medication, which may be another question that you have. If I'm on medication and being stabilized on medication and managed on medication, how am I going to get that medication? Well, again, through the advent of technology, we're able to send those scripts to the pharmacy, and we'll find ways, if you can't get out to the pharmacy to pick those up, that they can be delivered to you. It's very important to recognize that the ongoing treatment plan is not going to be interrupted. What may be different is the way in which that treatment is delivered. The treatment itself will continue to be delivered. So when you're taking a look at growing anxiety and stress about managing a healthcare issue, behavioral healthcare issue that you've been managing for quite some time, that won't change. What will change perhaps is the way in which we deliver that service. The third question may be around what medical tests I may need in order to continue to manage my disease. So if you're on a medication that requires lab testing, blood work to determine what levels of medication may be in your system, whether there need to be tweaks or changes to that medication, that lab work is still going to occur. Remind yourself, and again, even during this pandemic, that healthcare services are essential services. The ways in which we need to access those services may be a little bit different, but in fact, they're still going to be available to you. Providers of your care, counselors, psychiatrists, nurse practitioners, case managers, others are available to you and will be able to help you walk through those systems and strategies. Most healthcare providers, to my knowledge, all healthcare providers, are actually working on plans in ways to not interrupt service to our clients. And remember, I'm Dr. Phil Toll, and together we'll get through this.